So getting started with the trapezius. So the origin of your trapezius, it starts on the medial third of your superior nuchal line and your external occipital protuberance on the base of your skull. Then it goes down your nuchal ligament, so that's the ligament down your cervical spine, and then it's going to attach to the spinous process of C7 to T12 vertebrae, so all the way down here at the bottom of your thoracic spine. Then the insertion, that's going to be more distal or away from the axial skeleton. You can see that it attaches to the spine of the scapula here. Then it's going to attach to the acromion on your scapula, and then you're going to see the lateral third of the clavicle. That is where it's going to end its attachment. So again, it has a very broad attachment site. And this is functionally, when we start to talk about the deltoid, this is where the deltoid also attaches along this horseshoe-like region of the spine of the scapula, acromion, and lateral portion of your clavicle. So let's go over the innervation. So this is innervated by your spinal accessory nerve, cranial nerve 11, which supplies majority of the motor fibers. And then you have cervical nerve root 3 and 4 that contribute more to pain and proprioceptive fibers. So your trapezius, because fibers are running in different orientation patterns or different lines of pull, you can see that upper fibers, they kind of go from the skull down to your shoulder. And then you can see the lower fibers that go in an upward fashion towards that area of your spine of your scap on the medial side of your scapula. So because of that, it's going to have a lot of different functions or actions. So your upper fibers, it helps to elevate your scapula. The lower fibers depress the scapula, and the middle fibers just retract the scapula. It's going to pull the scapula towards the spinal column. With all of that, your upper and lower fibers, they work in a cohesive manner to upwardly rotate your scapula. So upward rotation, again, is if you think about the glenoid, it is going to rotate the glenoid so that it starts to point up, and that's usually going to coincide with a lot of elevation of your arm or lifting up your arm above shoulder height. The trapezius, again, it really functions to help stabilize your scapula for, of course, shoulder function, deltoid action, but really with all shoulder and upper body exercises. It's going to help with upward rotation of the scapula, especially when you're doing things that involve your arm reaching overhead or above shoulder height. In many lifts that we do, especially things that we're holding on to weight, it prevents the shoulder from falling anteriorly and inferiorly because it's going to have that retraction component and that elevation component of your shoulder blades or your scapula. So you see this primarily in shrugs, in rowing types of exercises and movements, even things like deadlifting when you need to hold the bar and you need to retract and keep your shoulder blades in that neutral position. And because of its orientation, you're going to use your traps, especially the upper trap, for a lot of neck stability. In football especially, it's primarily used to absorb that contact so that your shoulder does not depress when taking the collision or the hit. So these are all functional applications of what your trapezius does. Provides a lot of scapular stability and keeping the scapula and shoulder girdle in place, counteracting forces of gravity or anything that's depressing your shoulder. To stretch your traps, you're going to stretch it in varying angles depending on what section you're trying to lengthen out. So your upper traps, typically that's going to be with shoulder depression and moving your head to the contralateral side. Also with some flexion, that'll help to get some of those fibers stretched and lengthened out a little bit more. For the middle fibers, extreme protraction. So usually grabbing onto something, rounding your shoulders and protracting your shoulder blades forward, that is going to get the mid traps. And for the lower fibers, you are going to try to create protraction. And typically what I like to do is have my arm below shoulder height so that you get some downward rotation of the scapula along with that protraction. And that is how you're going to lengthen out your lower trapezius fibers. Hopefully you can use this information and apply it to your training, your clinical practice or coaching practice. And if you like this video, hit the like button below, subscribe to my channel. If you have any questions or feedback, drop it in the comments below. And stay tuned for more anatomy videos in the future. Aloha.